Chosen was started in 2014. We are a 501c3 nonprofit. We function entirely by a group of dedicated donors that have the same vision as me and want to see the modern first world surgery be done in the third world and not provide any barriers such as finances, that patients are selected entirely based on disease and not whether they can pay. Chosen stands for Christian Ophthalmic Surgery Expedition Network. My wife Christy came up with that. It was very clever when we were looking at a name. We tried a variety of combinations that we wanted Christian, and we wanted ophthalmic in it, and we wanted to show that we went out and did projects and we're a group of people, and my wife very cleverly came up with that acronym. Since I was a young person, probably I could have been as a youth or early teenager, I've been interested in mission work, and I felt like, or I believe I have a calling from God to do this, and I didn't know what form it would take. And as I grew up and finished medical school and went into ophthalmology, I got into mission work immediately, and I thought I would be someone who would go into the mission field and live in a place and work. But as I've gotten older, my roles have evolved more, where I've become a clinic builder and a funder and a big participant on high volume projects, putting the right pieces together and the right people together to make sustainable healthcare in very poor places, and for the patients to bring it free of charge. That's something that was important for me, to reach people that were unable to pay and to be able to give them the same quality of care that would be received in the United States. We even have toric intraocular lenses and multifocal intraocular lenses that we would be using on indigent patients here free of charge, where in the United States somebody would pay thousands of dollars for the same thing. We've put together in this center 4 Centurions, 2 Infinities, 2 Constellations, 6 Zeiss microscopes, a Luxor Revalia. On the clinic side, we have 2 argon lasers, we have 2 spectral domain OCTs, we have 6 slit lamps, 4 wireless, Keeler wireless headsets, really top of the line equipment in order to do proper diagnosis and offer the same quality of care that can be received in the United States. The medical parts is fun and challenging to come down in a poor place that has very neglected disease. It's intellectually challenging to try to tackle these problems, and it's good camaraderie with the other doctors who are in the same situation, and we're all there to help each other out. But the most meaningful part of the trip is always to hear how God moves through this ministry in the lives of not just the patients, but also the volunteers, the doctors that come. We've had patients hear the gospel and believe and become disciples of Christ by going on our mission trips. And that's the most satisfying thing, that God's called us for this purpose, that we're able to use our wallets and our talents in order to further the kingdom of Christ, not for our glory, but for His. Our board of directors is deeply committed to sharing the gospel and making disciples of all nations. That's our end. The eye surgery, as much as we like to talk about it, and it's important that we want to have good equipment so that we can have good results, but it's only the platform that we draw the people to us, and everyone has an opportunity to hear the gospel, and we bring pastors and have a chaplain at this Chosen Eye facility in Nicaragua that will help plug patients in to local churches and to follow up with them after they receive care with us. We expect this center will be doing the only modern cataract surgery using small incision phacoemulsification in Nicaragua on public patients, and will be virtually the only one doing modern small gauge retina surgery on public patients. Our first order of care is to get the needy people who have no possibility of ever receiving care and give them the best quality of care that they can get. And that's as is the platform so that we can effectively share the gospel of Jesus Christ for them. Our secondary goals would be to provide an opportunity of education and for local Nicaraguans, and be able also to offer some jobs to the community that could help us along with our mission. Perhaps also to be able to do some research activities here as our facility is set up well. We could run clinical trials perhaps and further the medical literature that way.